And syndrome, fat embolism for your Nclex. We already talked about that. I'm on page number 7. The numbers are in the bottom and they're divided 7 and 8 on the same page. Amputation, I'm going to talk about now. Amputation, which of the patients will go for amputation? Diabetic. Because what is the problem with diabetic patients are? What is it diabetic patients have a problem? Poor circulation. So remember, when they come back after amputation, what is the problem is going to be? Healing of the wound because they are diabetic. So what do you keep in the room when your patient is coming back from amputation? Now, it is closed, open, and there is a word is called BKA and AKA. You have in the last line, on the same side, number 7, AKA and BKA. What is AKA? What is AKA means? Above. What is BKA means is below. So BKA and AKA. Patient has two kind of amputation. The risk for wound infection. What is the another problem when they come back after amputation? Bleeding. So what do you keep in the room? Tourniquet. When your patient come back, keep in the room is called tourniquet. What is tourniquet is? You tie on your patient's leg. It's a rubber tubing. And what do you need to have in the room? Trapeze. Are we clear? So what do you make sure you have in the room? Trapeze and tourniquet. And what position do you put when your patient come back after AKA and BKA? Let's see. It says open, close, delayed prosthesis fitting, residual limb covered with elastic bandage. But I want you to write down, and it says elevate 24 hours in the last line. So what do you do? Whether it's a AKA and BKA, what is your position? Elevate. Only for how long? 24 hours. After that, what position are you going to put your patient? I want you to write down the word prone position. Why? What are you preventing here? Write down the word flexion. What are you preventing here? Flexion. Remember, what is flexion is? Bending. So you are preventing flexion. So your patient come back. What position are you going to put them in amputation? Is number 1, 24 hours, elevate them. After 24 hours, you're going to put them in prone position, preventing what? Flexion. Everyone is okay. And check for bleeding in the upper line. And then you remember elastic bandage in the first line. What bandages are you using? Elastic bandage. And how do you apply elastic bandage? You guys have figure of 8. Are we clear? And what are you doing here? And remember the word shrinking of the leg. What are you preventing? Shrinking. You help them shrinking what? The stump. S-T-U-M-P, stump. And why? To fit in the prosthesis. So remember, when you're cleaning, you open it, wash it, clean it, and apply the bandage. Are we clear? So elastic bandages you're using. What are the complications of amputation? Are bleeding, number 1, and that's why you have tourniquet. Number 2 is wound infection. What is the third complication you have is, write down the word. What is the third complication you have? Phantom pain. Phantom pain. What do you give for phantom pain? Pain medication. If they have non-therapeutic, write down the word non-therapeutic. What is a non-therapeutic? Mean there is no drug. So what do you do for your patient when you're using non-therapeutic? You use TENS unit. Write down the word TENS unit. TENS unit. And what do you monitor for TENS unit? It is applied on the skin. Skin irritation. So TENS unit can cause skin irritation, clean the skin and change the site. And it is given for what? Preventing the phantom pain. Next is position is prone. Exercise, crutch walking. What kind of exercise they're going to use it? The crutch walking. Phantom pain is the pain, and write down the word tense unit. Now, I want you guys add there. If you have AKA above knee patient, the problem is here is rotation. Their legs are moving and they are rotating. And what do you use here? Trochanter roll. You can use pillow, you can use, but also trochanter roll. You can use sandbags, you can use the pillow. You are making the position. So what are we using here? Trochanter roll. Any question? Hip surgery, amputation question. How do you keep the leg in a position? By using trochanter roll. Are we clear? You can use the pillow, you can use the sandbag, but the trochanter roll is your best answer, and that's what we all need to know. And what do you do if you have below knee amputation? The problem is flexion. This is rotation, this is flexion. So what do you tell your patient here? Do not sit all day in the chair or on the bed. Why? Because if they're sitting, the leg below knee is going what? Flexion. So you prevent flexion. So your teaching questions are in amputation. So everyone should know hip surgery. We all know amputation question, and amputation tense unit is important, BKA, AKA, and shrinking of the stump. Are we okay? Next is, we already talked about the vitamins on this page. And make sure you guys memorize your B1, berry, folic acid for anemia, B6, you're looking for paresthesia problem, B12 is pernicious anemia. What is the sign and symptom of pernicious anemia? What are the sign and symptom of pernicious anemia? Anybody? What is pernicious anemia? Sign and symptom are B12 is patient has what kind of tongue? Beefy tongue, red beefy tongue. Are we clear? Red beefy tongue, and what else you remember in lack of B12 is paresthesia, tingling sensation. Now we all know anemia, weakness, you feel cold, you get tired, and I want the main wording. So paresthesia means tingling sensation. So patient comes in and they ask you, what does your patient would complain? Paresthesia. Are we clear? Because they have tingling sensation. They are weak, they are tired easily. How do you treat them? B12 is pernicious anemia. How do we treat pernicious anemia? B12 injection. How? IM. How often do you give B12? Once a month. All life they will need it. How do you diagnose pernicious anemia? How do we diagnose? What test do we use? Schling test. Everyone, Schling test. What do you collect in Schling test? No, the urine specimen. 24 hours urine specimen. And how do you give B12? By mouth, and it excreted through the urine. Everyone remember beefy, red beefy tongue. Are we clear? And also, what do they have? Patient has paresthesia, and patient comes in, they must know they're treated by giving B12 injection. Where do you have a problem absorbing B12? Where is the problem in the patient? Which patient are risk for pernicious anemia? Which patient are going to be risk for pernicious anemia? Where is you absorb B12? In the stomach. So what is the problem? If you have gastritis, word, and gastrectomy. So what happened? They remove a stomach. And what is another word is called Bilroot 1 and Bilroot 2. Now they didn't give you pernicious anemia. In question, they said, patient come back after gastrectomy. What are you going to monitor? Pernicious anemia. So remember, where do you absorb B12? In the stomach. So if you cut the stomach and the stomach is small, what are you going to miss? B12. Are we clear? So patient who has small stomach and they've done surgery, they're going to lead into what? B12 deficiency. So that covers you. Calcium deficiency, and I told you rickets comes in where? In the children, and write down vitamin D deficiency. Vitamin D, if you are lacking in your body, you cannot absorb calcium. Are we clear? And that is why either they can throw calcium or vitamin D deficiency lead to rickets. Rickets are in the children, abnormal bones development, and an osteomalacia is in the children. Now the next paragraph is culture. Very important, we respect all culture. And we check with the patient what do they want. But if they give you, for Jewish, you don't serve milk and meat together. Are we clear? And in Muslim, they have Ramadan and they do fasting for 30 days. Japanese, rice is main food and tea is their beverage. Greek, bread is served with every meal. So a lot of questions you do get in culture, not only knowing any other question you do and you get in culture, you make sure you read that. Enteral feeding. Hold if 150 or aspirated 50%, underline that, given an hour is aspirated. So whatever you gave and you get more than 50%, or if patient is vomiting, cramping, you hold or decrease. Now I want you to write down the word residual. Now this question is always before you start next feeding or before you give another feeding, what do you check? Residual. The word is called residual. And if it comes, I want you to write down 100 or more than 100, you hold the feeding. If it is less than 100, you continue feeding. And what are you checking? Residual. What is residual means is absorption of your food. That means it delayed. So if you are having more food, means write down the word delayed absorption. So you hold it, and what are you checking up before each feeding? Residual. Are we clear? So when you're feeding your patient, check residual. And if your patient is vomiting, are we clear? Then you also can stop and decrease. We already talked about TPN. We went with the first page, and so I will not do that. Under last in the bottom, you guys have specific gravity of the urine. It's important to know your normal specific gravity. How much urine is normal is 1000 to 1500 and pH 4 to 4.5 to 8. Next page, we are moving on number 9. What is a Creed method? Is called push urine out. What is the meaning push urine out? Abdominal pressure. You are applying, you're using hand and you're going towards the symphysis pubis. Which patient you will use it? Write down the word when you have urinary retention word. Or in spino bifida babies. Remember, spino bifida babies are having a problem in urination. They cannot pass. So what is urinary retention? So you put the catheter, or how do you remove the urine? By Creed method. What is the Creed method? With your hands, you're pushing it out. Pernicious anemia, B12 injection, we already talked about. Is pernicious anemia, beefy tongue, and tingling sensation, paresthesia, and gastrectomy patient, Bilroot 1 and Bilroot 2. Inhaler, when they're saying MDI, is called meter dose inhaler. And you're using inhaler, beclomethasone is your steroids. Proventil is your bronchodilator. They both are inhaler. Your patient is using 2 inhaler. Which one do you use first? Second one. Albuterol, open up the lungs. And second one, you are using beclomethasone. So remember, your bronchodilator And what do you do after you finish inhaler? What do you do? Rinse the mouth. Make sure, write down, rinse the mouth, very important answer. And what do you tell when they inhale? Breathe in slowly and hold it. Are we clear? Breathe in and hold it. Now I will move on your GBS and also your Parkinson. Now GBS and Parkinson I'm going to cover on this page, and you also have on page number 28. So when I will talk about, and I want you to go on page 28, and they have Parkinson and myasthenia gravis. So let's cover GB syndrome on this page, and then last we will move on other page and highlight it. So what is GBS is? What disease comes from what disorder? Neuromuscular. Guillain-Barré syndrome. But now when you have GBS, I want you to underline proceeded, caused by viral infection as well as immunization. Underline the word allergy, write down immunization. Patient has some immunization 2 weeks before can lead to GBS. I want you to write down also on the top, second reason is upper respiratory infection and GI infection, pre and post. Before and after you have upper GI and respiratory problem. So write down two things is respiratory and GI. Immunization, you already said. And also I want you to write down number 3, immune system. It's immune disease. So everyone should know it's immune disorder. It comes from allergy. Like if you do some other books and they said patient is admitted with GBS, what was the problem patient had before they had GBS? And answer was they had is immunization 2 weeks ago. Are we clear? What is another reason can be is infection, upper respiratory infection, immune system. How do you treat them when they're very sick? If you go on third line. So what is the treatment of GBS is, underline the word steroids. You treat them by steroid, plasma pheresis, and also the third treatment, immunoglobulin. Immunoglobulin. Everyone should know immunoglobulin. You can give them to treat because it's immune system disease. And removing plasma pheresis. What is plasma pheresis? They're removing antibodies. Write down, they're removing from the blood antibodies. Now what happened in GBS patients are, I want you to add in your notes, ascending paralysis. What kind of paralysis they have? Ascending. And also, the problem with them is if you go in third line, prevent is hazards of immobility because they're getting weak, so they cannot walk, they can fall. Underline the word is physical therapy, nutrition, eye care, UTI, and write down the highest priority would be respiratory problem, breathing. So write down the word respiratory, GI problem is important, and of the breathing, and GI means swallowing problem, legs problem, and so that is called your GBS. Now, I want us to move on page number 28, and I want to connect that is what is in your GBS. You have Parkinson, you have, and myasthenia gravis you have. I don't think so we have GBS on this page. But you do have on the under 28, you have Parkinson, you have myasthenia gravis, and you have scoliosis, cerebral palsy. So only you have here myasthenia gravis. So I will leave it, let's go back on the same page. So we'll be back when I do Parkinson. So everyone, let me repeat here. What is GBS is? Neurological problem. What paralysis they have? Ascending paralysis. What is the treatment for GBS is? Plasma pheresis, immunoglobulin, you can give them, and steroid. What is your highest problem are? Because they're getting paralyzed, respiratory, swallowing, walking, and also remember their bladder. They may not be able to pee. I will go on organ donation criteria, then I will move on Parkinson. So what is in organ donation? Now remember, a lot of people organ donation question they can give you is number one, they have no kind of disease. Somebody who's going to donate should not have any infection. Brain death of donor, third line. Before you take a donor organ, they must die is with the brain death. No history of cancer, no history of hepatitis, no infection. Underline the word blood group. So brain death is important. Make sure you check their blood group. If you're going in a newborn, they must be full-term babies, more than 200 grams. Only absolute restriction if you have HIV. Family member can also give the consent, and nurse can discuss organ donation with death related. I want you guys to write down the word consent. Whenever someone is giving organ donation, check their consent. You already know the brain damage is important. I want you to add there is continue ventilation. When you are removing the organ, make sure they continue their mechanical ventilation and continue IV fluids. Why? To hydrate the organ. So before you remove the organ, number one, patient must be having what? A brain death of donor. That means they're dying. Number two, continue mechanical ventilation. Fluid is important, and no diseases. In the children, there must be full-term babies when you are taking it out for organ donation. Now, you got to call immediately when patient is dying so they know they have to come and remove the organ. NG2 is also used. Why do we use NG2? Write down for feeding, and also underline the word aspiration of gastric content. What is the word is called here? Decompression. Write down the word decompression. So when you're giving, either you're feeding through the tube and you're removing the fluid, is called gastric content and aspiration. What do you monitor if you are aspirating the fluid from the stomach? What do you monitor? Make sure your suction is working. And if your suction is not working, nothing is coming out, what do? Position change, because maybe your patient is laying on the tubing. So what is the purpose of NG tube is you are using for feeding purpose and you are using for aspiration. When you're using for aspiration, what do you do for your patient? Turn them frequently. So make sure they are draining well. Now next is Parkinson's disease. What is Parkinson are? Is activities should be scheduled late morning. So they're very slow, and symptoms are tremor. Don't rush them because they're very slow. And what is the best time to let them do their things are in the afternoon. And what are they are having a problem here is tremor, and underline the word rigidity. They become very rigid, stiff. But the first thing is they are having a tremor. And underline the word akinesia and bradykinesia. Write down on the top, brady means slowing. Bradykinesia means they're slowing down with their movement. And also purposeless gait. And write down the word shuffling gait. What kind of gait they have? Shuffling. And dysphagia, underline the word. Drooling and mask-like face. What kind of face they have? Mask-like. And they have no emotion. And we will go on nursing care. How do you give nursing care? Is for them are, number one, exercise. You go finger exercise. I want you guys to write down prevent from aspiration because they are drooling. So don't let them, and don't be hurried. The medications are, what are the drugs for Parkinson patients are? Artane, Cogentin, L-Dopa, Paraldol, Sinemet, Simetrel, and I want you to add Aldaprel, Aldipril. So write down this medication, Aldipril, Eldepryl, Aldipril. Add another medication. Ambulation is important, and tell them to keep their back straight because they're moving like this. So keep their back straight, and when they are walking. And what is the problem with the patient is intellectually they are okay, but they're very slowing down and they can go into paralysis. I want you to add the drugs. In the drug question, give them before meals. Before meals, it helps them to swallow and eat and chew. No B6 and no Maui. And be careful with glaucoma patients. So that is your Parkinson. I will move on page number 28 and see what all we have there on Parkinson patients. And I will also do myasthenia gravis. So if you go on page number 28, and on under 28, on top, if you look Parkinson, what is in Parkinson is deficiency of dopamine. So make sure you attach that. Lacking of what? Dopamine. We already said they have tremor, they have rigidity, and also shuffling gait. And they cannot talk. Mask-like face is important. If you go on the other side, ambulation, range of motion is good. Medication, we already talked about it, and those goes in your Parkinson. So make sure we cover that along with this page. Now, so we have done, what are the disease we did? Is GBS. We did Parkinson in neuro. I want you to cover myasthenia gravis on this page. What is myasthenia gravis? Is neurological problem and deficiency of what? Underline the word acetylcholine. What is deficiency of? Acetylcholine. And what happened to the patient with myasthenia gravis? Underline the word muscle weakness, and I want you to write down voluntary muscle. What is the meaning voluntary? They cannot eat, they cannot chew, they cannot swallow, they cannot talk. So what muscles are affected? Voluntary muscle. What is lacking here? Acetylcholine. What is the big problem with myasthenia gravis? Think about the face. Write down the word on the side, face. And what happened on the face? Breathing problem. Because their muscles they want to breathe, but they can't breathe. And breathing. Respiratory distress. Remember, on respiratory question, they don't give you one word. The meaning is you check their oxygen level and pulse oximetry. Keep the suction there. Turning frequently because they can develop pneumonia. So the problem is because the muscles are weak and they cannot breathe, and maybe you got to help them for preventing pneumonia. Are we clear? And also breathing problem. Dysphagia. What is the meaning dysphagia? Swallowing problem. So what do you do when you're feeding your patient? The risk for swallowing, let them sit up and feed them. And what do you tell them when they're swallowing? Bend their neck forward. It's called flexion. Are we clear? And also, I want you to write down with myasthenia gravis, the word is called ptosis. Their eyes are closed. So write down the word ptosis. So they will say you are admitting a patient and you will see, that means they cannot keep their eyes open. Their eyes are closed. And write down number 4th problem, they cannot talk. Their voice is very shrill, very soft voice, and they are having hard time. So everybody remember, the GBS, I said ascending paralysis, going in the back, up. But what is myasthenia gravis? Starting up here. And what is the problem here? The breathing problem, swallowing problem, talking problem, and their eyes. And now I want you to go in the other side. What do you do for your patient here? Number 1, eye care. Also, medication is, what are the medications are? You can give steroids and anticholesterol. But what are the medication we have for them are mestinon. I want you guys write down M-E-S, mestinon, and prostagmin, and tensilon. These are very common drugs. You can also give them tensilon injection. They can give them mastinin and also prostigmin. So as you're moving, you got to give them the medication. Mastinin, M-E-S-T-I-N-O-N-I-N. Prostigmin and tensilon. And do not change their medication time. And give them with food. When their eating is better, you give them. So these are very important, your patient are. Avoid crisis. That means avoid infection. If they have infection, they're going to go in crisis. And ability to swallow, sudden ability to swallow. I want you to write down in myasthenia gravis is called myasthenic crisis. When they give you the question, what is myasthenic crisis? Is remember their medication is low. They need to increase medication, or patient need the medication. Cholinergic crisis means too much of medication. Everyone is okay? And so when you have too much of medication, you stop the medication. So we discuss about myasthenia gravis. What is myasthenia gravis is lack of acetylcholine. Are we clear? Parkinson is lack of dopamine deficiency. And myasthenia gravis, you remember from upper part. Their muscles are getting weak. All your patients, you let them rest when they have problem with the patient there. So let's go back on the same page where I left it. And we talked about myasthenia gravis. We talked about is your patient with on your, what was on page number? We were on 9. Okay, 9, Parkinson we covered. Normal urine output, we already said on number 10, right on the top. The normal urine output is you must have no less than 30 ml. 50 to 63 is good. 1,200 to 1,500 is a good amount. Green leafy vegetable is very high in vitamin K. Which patient you will tell them not to eat green leafy vegetable when they're taking blood thinner? Write down the word coumadine. When do you take coumadine for anticoagulant? How do you give coumadine? Is by mouth. So when do you avoid taking green leafy vegetable? Any green vegetable when you're taking is what? Coumadine. And I want you to guys write down coumadine is your oral anticoagulant medication. When patients are going home, they can give them, but you got to teach them to come for blood tests. What blood tests do you do for coumadine? PT-INR. PT-INR. The best time coumadine you give them in the afternoon. Okay, so what is the best time you give them coumadine? In the afternoon. All right, so that covers coumadine. Let me quickly go some labs here before we close. Let me finish till here. Then we are going to stop. Hemoglobin A1C. For which patient do you do hemoglobin A1C? Diabetic patient. What are you monitoring your patient here? Is called glycemic control. Glycemic means sugar control. So at their glycemic. How frequently do you do? 120 days. What is the meaning 120 days? Every 3 to 4 months. Normal is now 7.6 from 4.5 to 7.6 is okay. But if it is 8, 9, and 10, that's not good. Okay, that means their sugar control is not good. Amylase. Which patient do you check amylase? Underline the word pancreatitis. So if your pancreatitis is here, is serum amylase. And what is another pancreatic enzymes are? Lipase and amylase. I want you to write on the side. Lipase. Lipase, remember, amylase is your pancreatic enzyme. If you have pancreatitis, your amylase level is going to be high. Next is ESR. ESR is called erythrocyte segmentation rate. Underline the word last line, inflammation. What are you checking? Inflammation. Which patient? You anywhere inflammation, but remember is what are the glomerular nephritis, in the babies, and rheumatic fever. You can go on rheumatoid arthritis. Very important. We all know if you have glomerulonephritis, it comes from causing inflammation and also rheumatic fever. Okay, so that goes in, and you have normal level. If you can remember, is good, but you must know hemoglobin A1C, erythrocyte sedimentation rate. Hematocrit you must memorize, because hematocrit is underline the word plasma to red blood cell. What is a hematocrit? Volume of plasma to the red blood cell. So red blood cell volume. And increase in dehydration. So if your patient is dehydrated, your in a high level of hematocrit. It doesn't mean they have a good blood cell, but they are dehydrated. And also write down hypoxia. Any question when you have a hypoxia, your hematocrit can go up. Decreases in excessive volume. What is excessive volume? Overhydration. When you have more fluid, your hematocrit can be increasing. So very important, everyone should know hematocrit. And CK. CK is your enzyme. Third line, in MI patient, creatinine kinase. That's a test you do for patient who has myocardial, or write down MI, and that is skeletal and myocardial enzyme. So what is creatinine kinase is good to know when you have, is the muscles are damaged, enzymes are produced. Glucose level, which patient do you check glucose level? Fasting blood sugar for your diabetic patient. Sodium is, we will talk about afternoon, is hypernatremia. Sodium level is very important. Hypernatremia means too much of sodium level, and underline the word dehydration. That means whenever you have hypernatremia, underline the word patient is dehydrated, and write down the word you give fluid. When you have hyponatremia, write down there, that means they have edema and restrict fluid. This is the way you memorize for your exam. Hypernatremia means you give water, they are dehydrated. Hyponatremia, write down on the other side, they are retaining fluid, restrict the fluid. Then you have chlorides, and the next page will move on. I'll just finish after this level. And potassium is very important. And I said, which patient your potassium level goes high? Which patient is high? Renal failure and Addison. Which patient has low potassium? In your Cushing patients, right? Cushing. So you lose potassium. Bicarbonate decreases when you're starving, and renal failure and diarrhea. Potassium is very important, sodium is important. BUN goes 6 to 20 for which patient? For kidney problem. And underline the word dehydration. It can go high. Not your kidneys are bad, but you're not drinking fluid. Creatinine clearance is also you're using for kidney problem, and lower level reflect renal insufficiency and may influence excretion of many drugs and toxin from the body. So for your kidneys, you're doing creatinine clearance and also BUN level. So I think we'll stop here. Then we come back, I will start where we left it. Okay? Every day we are going to continue until I finish, and then I'll move on to the other package. We'll be back in 2. Yeah. Are you one? You went out? No. Okay, okay, stay here. Are you working afternoon or morning or what? Morning. So you're off today. I know. Are you got a date or no? For your have you want to do this first? I haven't. Yeah, do your good. Yeah, do that. To practice your question. Have you been doing your questions?
I want to ask you something.
Yeah. Yeah.
So
Huh? 2 o'clock. Yeah, I'll finish, yeah. Well, and then wherever I finish till 6 o'clock, and then I'll move on. So I want to finish this and I'll continue some more. Oh, that's fine. You can do it. There's not much. Was he diabetic? There are a lot of people who are diabetic. Oh no, my low back. Oh, okay.
Before I used to do it, but I can open. I can't. When I'm reading.
Yeah, she's good here.
Yeah.
Don't delay, I will tell you. I know, we've been